Hi, this is Ashley Fierro. This is my presentation for Opiate Dependency for English 100. Opium is extracted from seed pods of the Papaver somniferum, which is the opiate poppy, a type of flower. Opiate drugs are extracted from poppies grown mostly in the Middle East and Southeast Asia. Opium and its derivatives temporarily block the pain. My thesis is the healthcare industry needs to have higher standards on prescription regulation for opiate users in America to stop the opiate addiction cycle. Oxycodone is an opiate narcotic pain reliever similar to morphine. An opiate is sometimes called a narcotic. Types of pain medication include codeine, fentanyl, hydrocodone, hydromorphine, methadone, morphine, oxycodone, oxymorphone, and others. Oxycontin is the most popular pain medication. It is applied in 10 milligrams, 15 milligrams, 20 milligrams, 30 milligrams, 40, 60, and 80. And they're all for oral administration. Opiates are central nervous system depressants. An overdose can lead to coma and death. Codeine, thiamine, morphine are derived from the opium. Heroin is derived from morphine. These are opiate drugs. They bind to opioid receptors in the body, producing dependence, tolerance, and addiction, as do non-opiate semi-synthetic opiates. Side effects include nausea, vomiting, drowsiness, dry mouth, and constipation, also urinary retention. Less common side effects are hallucinations, delirium, hives, itching, hypothermia, bradycardia, trachycardia, muscle rigidity, and flushing. And the most severe side effects are fatal overdose and respiratory depression. As the backbone of the U.S. healthcare system, nurses are essential to quality of care and well-being of patients. Nurses with untreated addiction can jeopardize patient safety because of impaired judgment, slower reaction time, diverting drugs from patients, neglecting patients, and making mistakes. The American Nurses Association says approximately 10% of nurses are dependent on drugs, making the incidence of drug abuse and addiction among nurses consistent with that of the U.S. populations. Experts in drug addiction among healthcare professionals say nurses' access to drugs and the stress of the job can contribute to a substance abuse problem. The state of Florida is the epicenter of Pharmageddon, a phenomenon of pill mills, or pain management clinics who often charge cash-only fees to patients needing opiates. If you have time after class, please tune into YouTube documentary and watch this rest of the 45-minute video of the OxyContin Express, and click on the link below. Treatment and detox. Methadone is a synthetic substance. It's different in chemical structure from morphine and produces the same effects in the body, including pain relief and feelings of euphoria. Methadone is commonly prescribed as treatment for morphine or heroin addictions or as an alternative to treat chronic pain since it does not promote addiction. My reflection on this topic or this research project was that how did my thoughts and feelings and ideas change during the course of the research? I plan to become an RN one day, so my thoughts on nurses being addicted to painkillers shocked me. To think that nurses are supposed to care for patients, but possibly be under the influence of pain medication was disappointing. Anything that I wanted to learn that I didn't, that was probably opium farms, pharmaceutical buyers, and how the government ties into all of this corruption. And frustrations and surprises would be the Vanguard documentary on YouTube. It really made me upset. The surprising amount of deaths associated with pain medication given by doctors was mind-blowing. Thank you.